Yeah, PCOD is something is very rampant. Believe or not believe, if I'm seeing like 10 patients in OPD, and if they are young, younger age group like 30 to 40 or 20 to 40 rather, so they 8 out of them they are having PCOD. So PCOD is sometimes the women, they are really getting scared and they go for the health checkup, or they get the ultrasound done and there is a PCOD picture in the ovary. What is PCOD? PCOD is polycystic ovarian syndrome, so, or disease. So basically what happens in any woman's life, ovaries, they are making single egg in a month. So in PCOD, we call it polycystic. Polycystic means they are, poly means many. So actually these are not cysts, they are the eggs. And there are so many eggs they start forming in the ovaries, and because so many eggs they start growing all together, there is no space for one single egg to grow to the age of maturity. That means until unless one single egg will not grow up to the size of 18 millimeter, we don't call it mature. So these are all very small eggs, like 2 millimeter, 3 millimeter, and the whole ovary is studded with all these small eggs. So in the bargain, what happens when the ovary is full of these small eggs, and there is none of the egg is getting mature, none of the egg is getting in good size. So in this situation, what happens? Ovaries stop making very good egg, and to conceive for every woman, there should be single egg of 18 millimeter size at least. So if the ovaries are not making egg, we call it anovulatory cycles. The menstrual, she is menstruating every month, but the cycles are, during the cycles she is not making eggs. So they find it very difficult to conceive. This is one scenario, but the most of the time the unmarried girls are coming and they complain of, doctor, I have been diagnosed with PCOD, I'm gaining weight, my periods are not regular, my periods are delayed. It's earlier I used to have cycle like every 28 days or 30 days, but nowadays for 2 months, 3 months, I'm not having periods. So the cycles are delayed and they're gaining weight. There is extra hair on the face, all over the body, on the chin, on the breast, and on the tummy. And they have got truncal obesity. Truncal obesity is because what happens in PCOD? So estrogen is basically female hormone. Testosterone is basically male hormones. So when ovaries are not making one single good egg, they stop secreting estrogen, and there is the dominance of the male hormones is becoming more over the female hormones, and this is the reason the body start getting extra hair. This is the reason we have got truncal obesity, and the tummy is becoming bigger than the other females. So this sort of scenario starts coming, and they start having hair fall. There's so many things. So they start complaining that this is all coming to me, I'm feeling lethargic, there is extra pigmentation on my body. So these are the symptoms of PCOD. So if they come to me, the treatment is altogether different. If somebody is young enough and the main problem is that the patient is gaining weight and there is extra hair on the body, we put them on insulin sensitizer, because basically insulin is the hormone which is controlling blood sugar in the body, and the body becomes, in PCOD, becomes resistant. Resistant means, so body is not responding at all to the insulin. So this is the reason you are gaining weight. This is the reason you have high blood sugar in your body. So we put them on insulin sensitizer. We put them on the medication which help to lose weight and which ask them to take measured diet, talk to the dietitian, put yourself on some dietary supplements or high protein diet, and do regular exercises. Exercises are very, very important, you know. So whole idea is to lose weight. So if they are losing at least 5 kg of the weight, that helps the hormones to come back within normal limits. And this treatment is basically for the young girls. But for the women who are married and they are finding difficult to conceive, as I told you, because are supposed to make single good egg, and they are not able to make single good egg. In such situation, we ask them, we put them on ovulation induction drugs, some tablet to help ovaries to make single good egg. So most of the 80% of the women, they are getting, they are happy and they are getting pregnant within 3 to 6 months of span of time. But some percentage of the women, like 10% of the women, whatever you give them medication, whatever they reduce the weight, still their ovaries are quite resistant. They are not making single egg. In such situation, we advise them a single treatment that we call it laparoscopic ovarian drilling. So this is basically surgery. This is only for the women who are not responding with the medication. So we ask them to get admitted, that single overnight they are supposed to stay in the hospital. And laparoscopy surgery, if you have heard about it, this we call it minimum invasive surgery or keyhole surgery also. So earlier, if you remember, earlier when any time if we have to do any surgery on the body, we have to used to make big cut, like 6 to 7 centimeter of the cut to go inside the tummy and to see the organ. But nowadays technology is very much advanced, and as I told you, I have myself super specialized into endoscopy surgery. We nowadays we just give 0.5 centimeter of the cut. You know, if you see this finger, this is basically 1 centimeter of the width. So half of the width of this finger we have to give cut, 0.5 centimeter of the cut. What we do with that, we just go to the ovary and we destroy or we take away the bad eggs basically, which are occupying the ovary and not letting the normal egg to grow. So we just destroy them, we just take it out, and we make the, basically we create the space for normal egg to grow. So this procedure is very simple. It hardly takes 5 to 10 minutes. It's a minor procedure. Only thing, she has to stay. Sometimes we can discharge the patient in the evening, or sometimes they just need to stay overnight over there. And good thing is, when we do such procedures, we get the opportunity to check the tubes, because sometimes we are thinking the lady is not getting pregnant because the ovaries are not responding, she has got PCOD, and there is some other factor. So any woman to conceive, basically we need a good uterus, we need patent, that means the fallopian tube should be working, and we need good sperm. So ovarian drilling helps ovaries to make good eggs, but at the same time, you put the dye in the tubes and we check whether the tubes are opened up or not. So we can check inside the uterus also. Sometimes there is inside the uterus there is a cavity where baby stays. So this cavity is normal or not, that also we can check. We call this procedure hysteroscopy. So these are the tiny scopes. We can put it inside the cavity, and there is hardly, hysteroscopy doesn't even need any cut. We just go through the natural orifice and we see inside the uterine cavity. So any obstructing lesion, any growth, any septum, anything, we can see and we can treat at the same time. So I call it see and treat approach. So the patients who are having, just to summarize, the patient who are having PCOD, we put them on the diet control, we put them on the weight reduction journey, ask them to do a little bit of exercise. If it's not working, then we put them on the insulin sensitizer or the treatment medication to ovaries to get help to ovaries to make good eggs. If this is also not working, the last resort is laparoscopy and hysteroscopy. We always help them with these minor procedures. And trust me, 60 to 80% of the women, they do conceive within 6 months of the surgery.